Ever wondered why certain medications are absorbed in your small intestine, specifically the ileum? Well, let's unravel the mystery of ileum pharmacology together. The ileum, for those who are not familiar, is the final section of the small intestine. It's like the last checkpoint before the food you consume moves into the large intestine. But there's more to the ileum than just digestion. You see, the ileum is a star player when it comes to drug absorption. Its extensive surface area, thanks to those tiny finger-like projections called villi, and its rich blood supply make it an ideal site for this process. When you take medication, it travels down to your ileum, where it is absorbed into your bloodstream. The ileum's role in pharmacology is not just about convenience, it's about maximizing the effectiveness of medications. So, the ileum isn't just a part of your digestive system, it's also a key player in how your body processes medications. But how exactly does the ileum absorb drugs, you might ask? Well, let's break it down. Picture this: you swallow a pill. It journeys down your throat into your stomach where it begins to dissolve. As it continues its trek, it reaches the ileum, the final section of your small intestine. This is where the magic happens. The ileum, with its twisted maze of folds and villi, is a marvel of nature's engineering. You see, these folds increase the surface area of the ileum, making it a perfect terrain for drug absorption. The dissolved drug particles come into contact with the ileum's lining, or mucosa, a thin tissue layer that acts like a sponge, soaking up the drug particles. These drug particles then enter the bloodstream through tiny blood vessels in the ileum's walls. So, in essence, the ileum acts like a gateway, allowing drugs to enter your bloodstream and start working their magic. Now that you know how the ileum contributes to drug absorption, what are the key takeaways? Let's review them together. Firstly, remember that the ileum, the final segment of the small intestine, plays a critical role in the absorption of drugs into our bodies. It's like the last checkpoint in the journey of a medication from your mouth to your bloodstream. Secondly, the ileum's unique characteristics, like its large surface area and high blood flow, make it an ideal location for this process. It's as if nature designed the ileum specifically for this purpose. Thirdly, the basic mechanism of drug absorption in the ileum involves the drug dissolving in the intestinal fluids, diffusing across the intestinal wall, and finally entering the bloodstream. It's a beautiful dance of biochemistry and physiology. Understanding ileum pharmacology isn't just for medical students or professionals, it's knowledge that can help us all make more informed decisions about our health and medications.